Welcome to Damel Consult Career Academy. If you're preparing for a healthcare assistant interview, then you're in the right place. In this video, we have a 30-question healthcare assistant interview quiz that will test your readiness. Whether you're applying for a position with a care home or the NHS in the UK, these interview questions will give you a real feel for what to expect. Think you can ace it? Take the quiz, score yourself at the end, and find out if you're truly prepared for your healthcare assistant interview. Don't forget to watch till the end for the answers. 1. How would you handle a patient who refuses to take their medication? Ignore their refusal and inform your supervisor later. B. Try to force them to take the medication for their health. C. Calmly explain the importance of the medication and address any concerns they might have. D. Leave the medication on their bedside table and walk away. 2. What would you do if you noticed a patient was in distress? A. Call for help immediately without assessing the situation. B. Observe the patient, offer reassurance, and notify the nurse in charge. C. Wait to see if the distress resolves on its own. D. Leave the patient alone and check back later. 3. If a patient asks you for assistance to go to the restroom, but you are busy, what should you do? A. Ask them to wait until you are done. B. Find a colleague who can assist immediately. C. Ignore their request and continue your task. D. Help them after completing your task, even if it takes a long time. 4. What is the best way to ensure patient dignity during care? A. Speak loudly to ensure they understand. B. Close the curtains or doors before assisting with personal care. C. Perform all care tasks quickly without engaging the patient. D. Allow visitors to stay in the room during personal care. 5. How should you respond if a family member of a patient raises a complaint? A. Tell them you are not responsible and ask them to talk to someone else. B. Listen to their concerns, show empathy, and escalate the issue to the appropriate person. C. Avoid addressing the issue to prevent conflict. D. Tell them to write down their complaint and submit it later. 6. What is the most effective way to communicate with a patient who has hearing difficulties? A. Shout so they can hear you better. B. Use simple language, speak clearly, and face them directly. C. Avoid communicating altogether and rely on gestures. D. Write down everything instead of speaking. 7. What should you do if you notice a colleague not following proper hygiene procedures? A. Ignore the behavior to avoid conflict. B. Gently remind them of the correct procedure. C. Report them immediately without any discussion. D. Follow the same improper procedure to blend in. 8. A patient becomes agitated and starts shouting. What is your first step? A. Shout back to establish authority. B. Calmly talk to the patient to understand their concerns. C. Walk away to avoid confrontation. D. Restrain the patient immediately. 9. You are working with a team to assist in patient care. What is the best approach to ensure effective teamwork? A. Focus on your tasks without consulting others. B. Communicate openly, support your team members, and coordinate tasks. C. Wait for others to ask for your help. D. Assume someone else will take responsibility for team tasks. 10. What should you do if a patient confides sensitive information to you? A. Share it with other staff for discussion. B. Keep it confidential unless it affects their care or safety. C. Post about it anonymously to get advice online. D. Avoid addressing it and move on to the next task. 11. A patient needs assistance with feeding, but they are embarrassed to eat in front of others. What should you do? A. Encourage them to eat in front of others for efficiency. B. Move them to a private area to provide assistance. C. Insist that eating in public is normal and they should adapt. D. Avoid feeding them until they are comfortable. 12. How would you handle a situation where a patient refuses to bathe? A. Respect their decision but explain the importance of hygiene. B. Force them to bathe for their health. C. Skip the bath and inform the family later. D. Ask another colleague to convince the patient. 13. A patient falls while you are assisting them. What is the first thing you should do? A. Panic and call for immediate help. B. Check the patient's condition and provide first aid if necessary. C. Lift them up immediately to avoid embarrassment. D. Inform their family about the fall before doing anything else. 14. What is the best way to approach a patient who has dementia and is disoriented? A. Correct them harshly to bring them back to reality. B. Stay calm, use a gentle tone, and offer reassurance. C. Avoid interaction to prevent distress. D. Force them to focus on the present situation. 15. If you observe a patient showing signs of abuse, what is your responsibility? A. Confront the suspected abuser immediately. B. Document your observations and report them to the appropriate authority. C. Ignore the signs unless the patient explicitly reports abuse. D. Try to resolve the situation on your own. 16. How should you handle a situation where a patient does not speak your language? A. Use gestures and expressions to communicate as best as you can. B. Avoid communicating altogether. C. Request the help of a translator or an interpreter. D. Insist they learn basic English to understand you. 17. What should you do if a patient complains about severe pain? A. Reassure them and report the pain to the nurse immediately. B. Tell them it's normal and to endure it. C. Provide over-the-counter medication without consultation. D. Ignore the complaint unless it persists. 18. What is the most effective way to manage your workload during a busy shift? A. Handle tasks as they come without prioritizing. B. Create a list, prioritize tasks, and communicate with your team. C. Focus only on your assigned patients. D. Work faster without considering quality. 19. If a patient with mobility issues needs help getting out of bed, what is the safest approach? A. Lift them out of bed without any aids to save time. B. Use proper lifting techniques or a hoist to assist them. C. Wait for another colleague to assist you. D. Encourage the patient to manage independently. 20. How would you ensure infection control while caring for patients? A. Wash hands occasionally and wear gloves for every task. B. Adhere to hand hygiene protocols and use personal protective equipment (PPE) as required. C. Focus only on tasks that involve direct contact. D. Clean surfaces only if they look dirty. 21. A patient with diabetes is refusing their prescribed meal plan. What should you do? A. Let them eat what they prefer to keep them happy. B. Explain the importance of the meal plan to their health and inform the nurse if they persist. C. Ignore the refusal and proceed with other tasks. D. Offer a sugary snack to prevent any complications. 22. You notice another staff member not following hygiene protocols. What should you do? A. Ignore it to avoid conflict. B. Report the incident to your supervisor immediately. C. Politely remind them of the proper protocol. D. Confront them aggressively about their behavior. 23. How would you assist a patient who is feeling homesick and lonely? A. Spend a few minutes talking and listening to them. B. Distract them with television or other activities. C. Suggest they call a family member and leave them alone. D. Refer them to a counselor immediately. 24. A patient requests information about their medication. What is your best response? A. Provide the information based on your understanding. B. Direct them to the nurse or healthcare professional for accurate information. C. Tell them to read the label on the medication bottle. D. Avoid the question to prevent giving incorrect information. 25. If a patient with limited mobility expresses frustration, how should you respond? A. Tell them to be patient as you are doing your best. B. Acknowledge their feelings and offer empathetic support. C. Avoid the situation and focus on other tasks. D. Ask another colleague to deal with the patient. 26. You notice a bed sore on a patient during your shift. What is your next step? A. Clean the area yourself and apply ointment. B. Inform the nurse immediately and document your findings. C. Wait until the patient complains before taking action. D. Cover it with a bandage and inform the family. 27. A patient is unresponsive but breathing. What should you do first? A. Call for emergency assistance and stay with the patient. B. Try to wake the patient by shaking them gently. C. Leave them to rest and check back later. D. Inform their family members immediately. 28. You are asked to assist a patient with bathing, but they seem uncomfortable. What do you do? A. Reassure them and ask if they would prefer a same-gender caregiver. B. Insist that the bath is necessary and proceed. C. Skip the bath entirely to respect their wishes. D. Inform the nurse and let them decide what to do. 29. A colleague tells you to perform a task you are not trained to do. What is the correct response? Attempt the task to avoid disappointing your colleague. B. Politely decline and explain that it is beyond your scope of practice. C. Ignore the request and continue with your assigned tasks. D. Report the colleague to the manager immediately. 30. What is the best way to handle confidential patient information? Share it only with trusted colleagues. B. Discuss it openly only in staff meetings. C. Ensure it is shared only with authorized personnel on a need-to-know basis. D. Store it securely but share it with the patient's family without restriction. Congratulations on completing the quiz. If you passed with flying colors, then you're well on your way to acing your healthcare assistant interview, whether it's with a care home or the NHS. If you didn't score as high as you'd hoped, don't worry. Take time to review the answers, brush up on your knowledge, and keep practicing. You're getting closer to your dream job. Make sure to subscribe to Damel Consult Career Academy for more helpful interview tips and career advice. Good luck with your healthcare assistant interview, and we believe you've got this.